Did you know that over 30 million people in the United States take ibuprofen every day? That's according to the National Institutes of Health. Whether it's for a headache, sore muscles, joint pain, or even a fever, ibuprofen, sold under popular brand names like Advil and Motrin, is one of the most commonly used pain relievers in the country. But here's something most people don't think about. What actually happens inside your body when you take ibuprofen? While it can be great for short-term relief, using it too often or for too long can cause side effects, some that are uncomfortable and others that could be serious. According to experts from the Cleveland Clinic, Mayo Clinic, and the Food and Drug Administration, ibuprofen can affect your stomach, heart, kidneys, and more if not taken carefully. In this video, we're going to explain exactly how ibuprofen works, what it does to different parts of your body, and the risks you need to watch out for, all based on information that has been checked and confirmed by health professionals. So, if you've ever reached for a bottle of ibuprofen, keep watching. This could help you make smarter and safer decisions for your health. Let's start with how ibuprofen helps with pain and fever. Ibuprofen works by blocking certain chemicals in your body that cause pain and swelling. These chemicals are released when you're injured, sick, or dealing with inflammation. By stopping those signals, ibuprofen helps reduce pain, bring down swelling, and lower fever. That's why it's so commonly used for things like headaches, toothaches, sore backs, or even menstrual cramps. Most people start to feel better about 30 to 60 minutes after taking it. Now let's talk about what it does to your heart and blood pressure. Ibuprofen can be helpful, but it's not risk-free. Some studies have shown that using ibuprofen too often or in large amounts may increase the risk of heart problems, especially in people who already have high blood pressure or heart disease. The Food and Drug Administration has even warned that regular use of ibuprofen may raise the chance of having a heart attack or stroke. So if you have any heart-related issues, it's important to speak with a doctor before using it regularly. How does it affect your stomach? One of the most common problems with ibuprofen is that it can upset your stomach. It lowers the amount of protective lining in your stomach, making it easier for acid to cause irritation or even painful sores called ulcers. That's why many doctors recommend taking ibuprofen with food or milk. It helps protect your stomach and reduces the chances of getting stomach pain, heartburn, or other digestive problems. What about your kidneys? Your kidneys help filter waste out of your blood. Ibuprofen can make their job harder, especially if you take it often or already have kidney issues. It reduces the blood flow to the kidneys, which can lead to problems over time. If you notice swelling in your legs or feet, feel tired all the time, or see changes in how often you go to the bathroom, those could be warning signs that your kidneys are under stress. Can it affect your energy or mood? Some people say they feel dizzy, tired, or foggy-headed after taking ibuprofen. These side effects aren't super common, but they can happen, especially if you take a lot or use it often. Older adults may be more sensitive to these kinds of symptoms. If you feel off or groggy after taking it, pay attention and talk to a healthcare provider about safer options. Is it okay to mix ibuprofen with other medicines? Ibuprofen can interact with other medications you may be taking. For example, if you're taking medicine to thin your blood, ibuprofen could raise your risk of bleeding. If you're on pills for high blood pressure, ibuprofen might make them less effective. And if you're already taking another pain reliever, combining them can be dangerous without a doctor's guidance. This is why it's always smart to ask a pharmacist or doctor before taking ibuprofen along with other medicines. After all this said, is ibuprofen safe? My answer is yes, but when used correctly. Ibuprofen is very helpful when taken in the right dose and for short-term problems like a headache or muscle soreness. But if you take it every day or use more than the recommended amount, it can cause real damage over time. The general rule is to take no more than 1,200 milligrams per day unless your doctor says otherwise. That's about 3 regular strength pills in a day. If you find yourself relying on ibuprofen all the time, it's a good idea to check with your doctor and see if there's a better solution. Ibuprofen can be a helpful friend when you're in pain, but it shouldn't become a daily habit unless a medical professional tells you it's okay. Like any medicine, it's important to understand what it's doing inside your body. We hope this video gave you a clear and simple guide to how ibuprofen works and what to watch out for. Everything we've shared is based on real research and confirmed by licensed health experts. You can check out the full list of sources in the description below. If you found this helpful, give the video a thumbs up, share it with someone who uses ibuprofen often, and don't forget to subscribe for more clear, trusted health info. Thanks for watching, and take care of your body, one smart choice at a time.